Hello everyone, and welcome to our lecture for this week about language and communication. We're going to be talking about a couple of different things today. First, we're going to talk about how language development and language deficits are related to the diagnosis of autism. Then we're going to talk about a few of the different areas of language development and communication skills that are impacted for those who are on the autism spectrum. The diagnosis of autism. Deficits in communication and language use are part of the diagnostic process for autism spectrum disorder. These relate to the first criteria, criteria A. If you look in the DSM-5, there's a second criteria, criteria B, but that does not relate so much to the use of communication and language. So the way it reads in the DSM, to be diagnosed with autism, there need to be present persistent deficits in social communication and social interaction across multiple contexts, as manifested by the following, currently or by history. I want you to pay special attention to that phrase there, social communication, remembering that language and communication exist for social purposes, and we use them almost solely for social purposes. So you can't look at language development, you can't look at communication skills separate from social abilities and social development because language exists for social purposes. So we're going to see deficits in social communication in two different areas in order for a diagnosis of autism to occur. The first area is deficits in social emotional reciprocity, so the back and forth of communication, the ability to use language, the ability to communicate in any sort of relationship with another person. Even if it's just a brief 5-second interaction, it's still a relationship that exists in that moment. So some examples of that, an abnormal social approach or a failure of normal back and forth conversation. Could be a reduced sharing of interests, emotions, or affect. Could also be a failure to initiate or respond to social interactions. So all of these are related to communication abilities, and there's going to be a deficit in this area for those on the autism spectrum. The second area where we expect to see a deficit is in nonverbal communicative behaviors that are used for social interaction. We'll talk more about that in a few minutes, but here are some examples. Poorly integrated verbal and nonverbal communication, abnormalities in eye contact and body language, or deficits in understanding and use of gestures, to a total lack of facial expressions and nonverbal communication. So these are the two areas where we need to see deficits in order for a diagnosis of autism to be given. And here, just for some clarity for you, this is what's also included in the DSM-5, and this is something that's different compared to previous ways that autism was diagnosed and conceptualized in the DSM-4 and prior. So there are these three severity levels. I'm not going to read them all for you. You can kind of print them and take a look at them. I just want to highlight a couple of things here. So we range here from level 3, requiring very substantial support, to level 1, requiring support. So this, remember, is part of where the spectrum of autism spectrum autism spectrum disorder comes in. So if an individual is at a level 3, when they're diagnosed, you're going to be seeing severe deficits in verbal and nonverbal social communication skills. And these are going to cause severe impairments in functioning. So this is where you're going to think of people who have very limited use of language, if any use at all, and they are severely impaired in their ability to interact with others in any sort of communicative fashion. And this is going to range all the way down to level 1. They only require some support. So without some support in place, deficits in social communication will cause noticeable impairments, but with those supports in place, a person at level 1 should be able to function in a fairly typical way in a normal environment. So there are three major areas of our language and communication abilities as humans, and all three of these areas are affected for those on the autism spectrum. The first area is our verbal use of language, and this includes both our expressive and our receptive use of language. So expressive being how we express ourselves to others, and receptive being how we understand other people's expressions towards us. There's a nonverbal area of language and communication. This involves gestures and body language and other sorts of areas like that. And there's also the use of social pragmatics, and this is the area that governs how we use language and what's considered appropriate and inappropriate in any social setting. So let's go ahead and talk about these different areas. For verbal language use, expressive language. So expressive language can be affected in a really wide range of ways for anyone on the autism spectrum. And again, I want to remind you that's why it's called a spectrum disorder, because there is that range. So this can be all the way from someone who completely lacks any expressive language, they never speak, to someone who has a complete typical use of language but maybe doesn't understand how to use language appropriately all the time. So that's a really big range for one disorder to be able to see that kind of difference in abilities, but that is what's the case with autism. Think back to what we were talking about just a couple of weeks ago about the brain basis for autism. Because we know that the brain is affected and things are being processed in different areas of the brain, or different areas of the brain are functioning in a little bit of a different way than for a typical individual, that's why language is showing up in all these different sorts of ways, and it's not developing in the way that we would typically expect it to. So here's what you might see in an individual with autism spectrum disorder. You may see a child who completely lacks language. You may see a child who uses a sing-song voice when talking, and this might be repeating a similar word over and over again, or whenever they talk, their voice just has a sing-song quality to it, or they may just be making sounds, kind of walking around and saying things that sound like da 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 over and over to themselves, so there may not be any actual words involved. Sometimes when children are using this type of language, we're not really sure whether they're using it in a way that's just pleasing to themselves, something they enjoy hearing, or whether they're using it in a communicative way, and it's not always clear which is the case. So that's another example of how a child might be using speech or sounds that are unusual, things that we're not accustomed to hearing. A child or a person on the autism spectrum often has difficulty expressing their thoughts and their feelings. There's a book that's been written by Temple Grandin. It's one of the suggestions for your book review assignment. It's called Thinking in Pictures, and Temple Grandin is a really interesting individual because she does have a diagnosis of autism, but she has managed to find ways to not only communicate with other people in a really excellent way, but to become an advocate for those with autism and to further her own education and abilities to a really significant level. We'll be talking more about her later in the semester. But in her book, Thinking in Pictures, she describes pretty vividly the fact that she experiences in her own mind, she experiences the world around her in an entirely different way than a typical person does. Her processing of sensory information is not like how you and I process the world around us. And so think about that. If you're experiencing the world in an entirely different way, how do you express that in a way that other people are going to understand? So a child on the autism spectrum really might just be at a loss for how to even begin to communicate their feelings because they lack the words to do so. You may see children on the autism spectrum making a lot of irrelevant comments. This could happen during, kind of story time, circle time settings in a classroom. This could happen really at any time. One reason that children might be making these irrelevant comments is because they might be arranging their information in their brains, in their minds. They might have a different set of mental schema than we're used to thinking about. So all the information that we get on a daily basis, our brain has to organize it in some way. And if your brain is working in a different way, well, you might be organizing your information in a different way. And so the child might be making a comment that is relevant to them, but because we're not thinking about the world or we're not thinking about this topic in the same way that they are, the comment seems really irrelevant to us. So it's always important to think about that if you're working with a child with autism and it seems like they're saying things that are really coming out of the blue. Try to see it from their perspective. A child on the autism spectrum may have difficulty talking about others' interests, and this is also related to their social development and their lack of ability to take on other people's perspective, things related to that. Some children on the autism spectrum speak in an overly formal manner. That may be because they're using something we call borrowed language, so they're trying really hard to learn how to speak correctly. But instead of being able to kind of take what they've been taught to be their own, they're just using it the way they know they're supposed to before they actually understand the proper use of it. A child on the autism spectrum might also talk incessantly. This happens not just with children, but with adults too. They don't understand how to follow social and nonverbal cues as to when they need to give the person a break, whoever's listening to them. So these are some ways that differences in expressive language show up. One final way that a difference in expressive language shows up is in something called echolalia. And echolalia is a phenomenon that you see in children or adults with autism, and it's simply defined as the repetition of heard language. So this can be either immediate or delayed, and it might sound like something, a child who's going to repeat another person's question or statement. So if you're working in a classroom with a child with autism and you remind them that they need to keep the sand in the table while they're playing at the sensory center, you might then for the next half hour hear the child saying things like, sand in the table, sand in the table, sand in the table. And it's not, again, really clear whether they're doing this in a communicative fashion, or are they doing it to help themselves process it, or maybe are they just enjoying the way that those words sound to them. You might also hear children repeating a lot of sounds. If you clear your throat, you might be listening to throat clearing sounds for the next 20 or 30 minutes. And sometimes we see echolalia when children enjoy reciting lines from movies over and over again, whether or not it's in an appropriate setting. So that was expressive language. Receptive language. Children on the autism spectrum also have difficulty with receptive language. They typically have difficulty understanding non-literal language. Children on the autism spectrum are typically very literal. So any part of language that involves kind of nuance or subtlety or thinking about things in, a double kind of way, something having two meanings at the same time. I've given you a little bit of a list here. Things like humor and sarcasm, right? Not taking someone just at their word, but understanding that language can be used in sort of this playful, different way. Understanding figurative uses of language, even just things like the kinds of sayings we have, like it's raining cats and dogs, right? Or the cat's got your tongue. These are things that a child on the autism spectrum may have a really difficult time understanding. A child on the autism spectrum may also have difficulty following directions, and this can often be related to processing. Children who are not on the autism spectrum sometimes have difficulty following directions. Sometimes it's just because they're 2 or 3 years old. There can be other difficulties related to this. There can be something called an auditory processing disorder. So the time that it takes a child to process information that they have received through their auditory sense sometimes takes much, much longer than for a typical developing child. And this can be true for a child on the autism spectrum as well. Nonverbal communication is something that we see almost universally with individuals on the autism spectrum. So this relates to a limited ability to use and understand facial expressions, body language, gestures, and think about how much this impacts all social interactions, right? If I can't understand what someone's nod or head shake, what it means when they start to turn their eyes away from me, if they give me a shrug, if I can't understand all of those cues, I'm going to have a really hard time engaging in the back and forth reciprocity that is supposed to happen during any kind of communication with another individual. The last area of language that is affected for those on the autism spectrum is pragmatics. And when we talk about pragmatics, we're talking about all the social aspects of language. This means that individuals on the autism spectrum have difficulty with the rules of conversation. There are lots of rules that govern all the time how we're supposed to talk to people, when we're supposed to talk to people. This is very challenging for those on the autism spectrum. You're going to see this when they're doing things like interrupting others, asking inappropriate questions, or using very inappropriate language, often including swear words or vulgar language. You're going to see this when they're avoiding eye contact, when they're trying to talk with someone. They're going to have difficulty starting or maintaining conversation. They may fail to initiate or respond to social greetings. They may keep talking after the listener has stopped listening. They may keep talking even after the listener has walked away. And they may fail to distinguish between being laughed at and being laughed with. So these are all ways that lack of pragmatics affects children.